to brush the teeth of our dogs. Laura Nativo is here. She's brought along veterinarian Dr. David Nielsen. They're here to tell us why this is important. A lesson one learned firsthand. Huh?
Did you know that 80% of dogs and 70% of cats...
Wait a minute. What is that? What is that? I just got it out of his ear.
Yucky.
What is it?
Yucky little bug from the grass.
Okay.
So
sorry.
80%.
As long as the doctor was here. Okay.
Check my ears.
80% of dogs and 70% of cats show some sign of dental disease by the age of 3. That's so young. And dental disease, the infection can lead to problems in their kidney, their lungs, their liver, even their heart.
Correct.
And Dr. Nielsen can expand on that medically.
Yeah, so why is it if you get an infection in your teeth, how does it affect the dogs?
Same way it affects people. It's a great question, because what happens is, even when you brush your teeth at lunch, Mark, you dislodge bacteria into your bloodstream.
Really?
So the question is it a bad bacteria? Because there's 700 species in the mouth of a person and dog. And where does it lodge? You know, does it get heart, liver, as you said, lungs? And until we can trace a bacteria scientifically, it's more difficult to prove, but we know that there's a relationship.
Is there a relationship? Because with some people, they say with gum disease, it also can affect the heart. Is it the same thing in humans? Is it the same with dogs?
Exactly the same.
Oh,
wow, they are a lot like us. So we are here not only because the month is an important month to raise awareness to this, but Laura, you tell us your journey that you went on, and
because you got sick.
Absolutely, I want everyone to learn from my mistakes. Preston just had a dental surgery, and we're going to roll in a tape so that you guys at home can see. So Preston, I had taken Preston in for his senior geriatric exam and discovered he had a loose tooth, and he also had signs of kidney problems, which was really scary. So I took him into Dr. Nielsen, who's a trusted friend, and he needed to have a dental surgery.
And we use anesthesia that's actually safe, the same drugs that you use in humans in the monitoring too. So we use propofol, we use sevoflurane. So the safety factor has really gone up over the course of my career. It's just really quite amazing. In fact, my clients probably greater risk driving to the hospital than they do having their dogs anesthetized.
Oh my gosh.
Probably wondering if it looks so drugged up.
It's so hard. I insisted on sitting in for the surgery. It's so hard to watch. But if you could see in the video, Preston had a loose tooth. What we discovered is he actually had a tooth that was fractured below the gum line.
So you couldn't see it.
And that's why.
But we picked it up radiographically, and that was bothering him more because every time that tooth moved, it was basically poking.
But is that an indication that you weren't brushing well?
I hadn't been brushing every day. You know, Preston has gone through dental surgeries before.
Do you have to brush every day?
Now we see the relationship.
You really do.
I know we brush every day, but do you have to? Your doggies have to brush every day?
Yeah, it's really the same.
It's so hard to brush their teeth.
Well, it's not for every dog.
Yeah.
I mean, like the smaller the dog, the rounder the face, then they turn into a spinning top. But if you catch them young and then create a bribery situation, then afterwards, like with my 2 Moonsterlanders out on the ranch, we go like, wow, that was really a lot of fun. So it's like, oh, good, we get to have more fun.
How do you train your dog? I have a hard time training my kids, let alone my dog, to brush
teeth. It's easier to train dogs and kids in this day and age.
In the same way?
It's true. Positive reinforcement, lots of love and discipline. So we have a tape of Delilah, who's my bigger dog. The key with the larger dogs, I like to use a real human toothbrush. And we've got this tape. So you see Delilah, I have her in my lap, sort of. She's laying down in a very calm position. And I'm making it fun. I'm getting my toothbrush in there, but we're playing games in the middle. I have her kiss me. If you're doing clicker training, you can click whenever she approaches the toothbrush. So you're just using positive reinforcement.
But you're not using toothpaste.
Yes, you're using a doggy toothpaste.
Oh,
Is it minty fresh?
It can be, or it can be meat or poultry flavored as well.
Right.
But it's specifically designed for dogs and their teeth.
And the key is to do it with their mouth closed, because everybody wants to open their pet's mouth. And what do? They move their head all around. So you just need to do the outside uppers and the outside lowers. If you get really good at it, you can do it in a minute.
Well,
and you'll see, I'm going to get in here with Preston.
Okay, so
it's really hard to get in with the smaller dogs. No one has come out with a good toothbrush, unfortunately, to get into these back molars. So I'm using my finger.
What are you using?
It's a dental wipe, and it has a solution in it. And so I'm using my fingers to sort of rub the plaque and tartar off of his teeth, and he doesn't like it.
Amazing.
But I say, you're a good boy.
Okay, now you're feeding him, so So let me the food that you give them, is kibble better for doggies, or is the soft dog food better? Canned?
If you brush their teeth, it doesn't matter.
It doesn't? Okay.
But there are certain dog foods that will help clean the teeth in the back of the mouth, but like the canines, which get a lot of disease and incisors, it doesn't help those at all.
Okay.
And there's a misnomer. A lot of people think, oh, well, if I feed my dog bones or kibble, is that enough? It's like you chewing on a hard pretzel instead of brushing your teeth. Like go a week without brushing your teeth, and how's that going to feel on you? So imagine that buildup if you don't brush your animal's teeth, what that's doing to the inside of their mouth.
Preston is a star of the show. For people who don't know, he's been here many times. How's the kidneys now that the tooth is better? Is that changed?
I've noticed a significant difference in his energy. He seems to be feeling a lot better, and we have to take him back in to get his blood work done to do a checkup.
Okay.
But I'm already seeing a difference in his energy level, and you can just tell he feels a lot better now. So it's really important that we caught it. If I hadn't, you know, a lot of people, they say, oh, my dog's got really bad breath, and they kind of joke about it, but it's not funny. It's something really serious that affects their health.
Well, that's what this month is about, is to raise awareness, to get out there and take care of our dogs'
teeth. Okay.